Subtypes of dementia. In this lesson, we are going to talk about the subtypes of dementia. But in this lesson, some of the subtypes of dementia will be discussed, and in the next lesson, the rest of the subtypes of dementia will be discussed. So now let's enjoy reading the subtypes of dementia. Many of the subtypes of dementia are neurodegenerative, and protein toxicity is a cardinal feature of these. First, Alzheimer's disease. Main article, Alzheimer's disease. You can see here, this is the picture of healthy brain, and this is the picture of severe AD or Alzheimer's disease. Brain atrophy in severe Alzheimer's. You can see the picture of brain atrophy in severe Alzheimer's disease. This is the picture of healthy brain, and this is the picture of severe Alzheimer's disease. Alzheimer's disease accounts for 60 to 70% of cases of dementia worldwide. The most common symptoms of Alzheimer's disease are short-term memory loss and word-finding difficulties, trouble with visuospatial functioning, getting lost often, reasoning, judgment, and insight fail. Insight refers to whether or not the person realizes they have memory problems. Common early symptoms of Alzheimer's include repetition, getting lost, difficulties tracking meals, problems with cooking, especially new or complicated meals, forgetting to take medication, and word-finding problems. The part of the brain most affected by Alzheimer's is the hippocampus. Other parts that show atrophy or shrinking include the temporal and parietal lobes. Although this pattern of brain shrinkage suggests Alzheimer's, it is variable, and a brain scan is insufficient for a diagnosis. The relationship between general anesthesia and AD in elderly people is unclear. Why? Little is known about the events that occur during and that actually cause Alzheimer's disease. This is due to the fact that brain tissue from patients with the disease can only be studied after the person's death. However, it is known that one of the first aspects of the disease is a dysfunction in the gene that produces amyloid. Extracellular senile flux species consisting of beta amyloid, A-beta peptides, and intracellular neurofibrillary tangles, NFTs, that are formed by hyperphosphorylated tau proteins, are two well-established pathological hallmarks of AD. Amyloid causes inflammation around the senile flux of the brain, and too much buildup in this inflammation leads to changes in the brain that cannot be controlled, leading to the symptoms of Alzheimer's. Now, vascular dementia. This is one of the subtypes of dementia. Vascular dementia. Main article, vascular dementia. Vascular dementia accounts for at least 20% of dementia cases, making it the second most common type. It is caused by disease or injury affecting the blood supply to the brain, typically involving a series of mini strokes. The symptoms of this dementia depend on whether in the brain the strokes occurred and whether the blood vessels affected were large or small. Multiple injuries can cause progressive dementia over time, while a single injury located in an area critical for cognition, such as the hippocampus or thalamus, can lead to sudden cognitive decline. Elements of vascular dementia may be present in all other forms of dementia. Brain scans may show evidence of multiple strokes of different sizes in various locations. People with vascular dementia tend to have risk factors for disease of the blood vessels, such as tobacco use, high blood pressure, atrial fibrillation, high cholesterol, diabetes, or other signs of vascular disease, such as a previous heart attack or angina. Lewy bodies. Lewy bodies is also another subtype of dementia. We are going to now talk about Lewy bodies. The prodromal symptoms of dementia with Lewy bodies, DLB, include mild cognitive impairment and delirium onset. The symptoms of DLB, dementia with Lewy bodies, are more frequent and more severe and earlier presenting than in other dementia subtypes. Dementia with Lewy bodies has the primary symptoms of fluctuating cognition, alertness or attention. REM, sleep behavior disorder, RBD, one or more of the main features of Parkinsonism, not due to medication or stroke, and repeated visual hallucination. The visual hallucinations in DLB, dementia with Lewy bodies, are generally vivid hallucinations of people or animals, and they often occur when someone is about to fall asleep or wake up. Other prominent symptoms include problems with planning, executive function, and difficulty with visuospatial function, and disruption in autonomic bodily functions. Abnormal sleep behaviors may begin before cognitive decline is observed and are a core feature of DLB, dementia with Lewy bodies. RBD, REM sleep behavior disorder or RBD is diagnosed either by sleep study recording or when sleep studies cannot be performed by medical history and validated questionnaires. Now Parkinson's disease is another subtype of dementia. We are going to talk about Parkinson's disease. Parkinson's disease is a Lewy body disease that often progresses to Parkinson's disease dementia following a period of dementia-free Parkinson's disease. So this is the end of our subtypes of dementia. Lastly, I'd like to repeat Parkinson's disease, a subtype of the dementia. Parkinson's disease is a Lewy body disease that often progresses to Parkinson's disease dementia following a period of dementia-free Parkinson's disease. So this is the subtypes of dementia. I hope you have enjoyed reading this, and thank you for subscribing to this channel, and thank you for the comments and likes you gave to this channel. Thank you very much.